Lorenzo, a big deal, and a lot of doctors, parents were waiting for this decision. The vote coming down just moments ago, as you mentioned, the shot was overwhelmingly approved, 14-0 by this CDC advisory panel. This is one of the final steps in the approval process. Hospitals around the country have been anticipating getting the green light, so they've invited patients who are most at need to be the very first in line. So let's verify. What does that mean for you and your child? Our sources, the FDA, the Robert Wood Foundation, and the medical director for the COVID-19 vaccine program at Children's National Hospital.
We're getting confirmation it's getting delivered throughout different areas.
Dr. Claire Bogard.
First, we want to vaccinate those who are most at risk of having severe complication from coronavirus, either based off of their own medical history or based off of where they live and their risk of exposure.
According to a hospital spokesperson, thousands of vaccines will be available in the next several weeks in more than a dozen locations. Wednesday morning, the hospital plans to vaccinate young patients by invite only. This guidance, sent to parents from affiliate Children's Pediatricians and Associates, says they anticipate high demand and recommend parents of, quote, healthy children head to a local pharmacy, health department, or school.
Yes, it was only studied in a couple thousand people, and we're about to roll it out to the masses and give it to millions of kids. And there is a small chance that we will be able to start identifying those 1 in a million rare side effects as we do that.
According to a news release, when the FDA first authorized the shot, the vaccine was studied in about 3,100 children ages 5 through 11 with no serious side effects. Still, the healthcare nonprofit, the Robert Wood Foundation, surveyed parents and found 71% are concerned about side effects. Dr. Bogard's advice to parents on the fence: talk to your doctor and weigh the benefits and the risks.
I'm going to take that chance because that'll give her the protection that'll keep her in school, that'll keep her healthy, and that will get us all one step closer to ending this pandemic. I myself am a parent, I'm a child advocate. These kids have given up so much to essentially protect the health of all of us, the old people in the community that are more at risk. In my opinion, they're incredible superheroes, and they deserve to feel safe again and to participate in a normal, healthy life.
Gotta say, when the doctor said that these kids are superheroes and have sacrificed so much, taking a look at those pictures kind of brings a tear to your eye. They have been through a lot. So what's the next step? The panel's recommendation will go to the CDC director for a final decision. In the meantime, Dr. Bogard from Children's National wants parents to be patient with the process while they're still working out the logistics. She does encourage parents to keep checking with their health department and even schools, who should be eventually offering clinics. Lorenzo?
Patience is still key. We know some parents still have that game plan in place as well to get their children vaccinated quickly, though. Delia, right. Thank you. All right, Gaithersburg-based Novavax has received emergency use authorization for its COVID vaccine overseas. The approval came from regulators in Indonesia, meaning shipments of the vaccine will be heading out that way immediately, but it could be just the beginning for this company. Novavax applied for regulatory approval in the UK and Australia last week. It is expected to file for authorization here in the U.S. by the end of the year.